2000, the World Health Organization established the Millennium Development Goals. One of these goals was to decrease maternal mortality rates by 75% by 2015.
However, the maternal mortality rate in the Philippines has not dropped significantly since 2000.
In the Philippines, out of 100,000 women who give birth, 120 of them die.
Authorities attributed high maternal mortality rates in developing countries to the absence of professional birth attendants during childbirth.
Overall, 62% of Filipino births are delivered by a skilled provider, and 36% are assisted by a traditional attendant.
More than half of women giving birth in rural areas do not have a skilled medical professional.
I live in Manila, so I had my baby in the hospital. We had a private room. A doctor delivered him, and there were nurses assisting. It went well. There wasn't any complications, just like my first. My husband was there with me. He paid for everything out of pocket, but we can afford that.
Socioeconomic status is a major factor that affects the maternal mortality rate. One disparity is cost. For a woman to give birth in a hospital, it can range from 20,000 to 100,000 pesos. That is around 1,700 to 8,500 Canadian dollars. Many Filipino cannot afford to give birth in hospitals, and it's just not an option for them.
In my village, we usually stay at home. That's what I did. There isn't a healthcare facility close by.
Another disparity is access to hospitals. There are many hospitals in the Philippines, but they are concentrated in urban areas. It is extremely difficult for many women in rural areas to reach these healthcare facilities. The Philippines also had a two-tier health system. This further separates the rich from the poor and even more. Those who are in poverty are unable to access private hospitals with the proper technology to facilitate high-risk childbirth.
When women deliver at home, the husband or other family members can take care of the mother immediately after the delivery. For many Filipino women, the hospital is a cold and unfriendly place. Especially for those in rural areas, the hospital does not always allow them to incorporate cultural practices.
The helot came to our home, and she helped me. She has delivered all of my children so far. We've had 4 now. We chose the helot because it's all we can afford. She isn't trained like the doctors or nurses, but she knows a lot. She taught me to carry ginger with me to protect my baby from evil spirits, and she told me to eat many vegetables to make my baby strong.
We didn't think about using a helot because we have a doctor. I think that's an older traditional practice. I have Western medicine at my school. It was an easy choice.
A helot is not a professionally trained health provider. Some of their practices have folk elements in them. However, many have been influenced by professional health teaching. If effective education programs can be developed for these attendants, it will accommodate traditional health beliefs while incorporating evidence-based medicine to improve health outcomes.
I am optimistic that if we make universal health care more accessible to all Filipinos, we will improve health in the Philippines.
As of April 2011, almost 4.4 million new poor families had been enrolled in PhilHealth, equivalent to a 100% increase in enrollment for the real poor.
The universal coverage reforms aim to increase the level of support provided by PhilHealth, particularly to the poorest families.
For inpatient benefits, fixed payments will be introduced and out-of-pocket co-payments will be eliminated.
The Department of Health has made progress towards attaining the strategic goals of increasing overall level of health spending, promoting universal coverage, improving allocative efficiency, and promoting technical efficiency.
The success of these initiatives could significantly bridge the maternal health gap and improve maternal mortality rates in the Philippines.